Hello and welcome to your assignment on writing a client referral letter to a psychiatrist. It's not that often that we get asked to do this, but occasionally it's necessary for us to make a referral to a psychiatrist for our client to get a medication evaluation. And there's kind of a specific format of information that we go through that we want to include in a letter to a psychiatrist. This assignment is going to explain this and walk through that information and give a little more supplemental information than just the paper written assignment did. Here are just some general things to be mindful of in any kind of communications that you're having with other professionals or anytime that you're representing yourself as a professional. You always want to be professional in your representation of yourself. So make sure that you're using your correct title. If you have intern or a license number, that you're including that sort of information. You want to be writing letter on letterhead if that's from an agency or your private practice, or for this you can just kind of create your own sort of thing. You want to be mindful to be ethical in your communications. So you're not using first and last names or too much identifying information. You can use initials. You can use a client's first name in these sorts of communications with other professionals. And you also want to be really mindful of HIPAA violations. And one of the important things here is that if this were really a letter that you were writing for a client to an actual psychiatrist, you would want to make sure that you had a release of or an exchange of information form signed by your client, signed by your client, designating that you are going to be communicating with the psychiatrist and for what purposes. You could actually include a copy of that letter in your letter to the psychiatrist. The first paragraph, basically, or the first step of your letter should include the basic information that you're giving to the psychiatrist. So what you're going to want to do is begin by introducing yourself. Again, that's your name, that's your title, that's your license number. If you work under a supervisor, that would be your supervisor's name and their license number. If you're working for an agency, you want to mention that. You also want to mention that you have a signed release of information in this first step of your letter. You're going to want to also just introduce your client, very basically, just kind of who they are, their name, basic identifying information about them, and you want to talk about the length of time you've been working with your client. You also want to state what the intent is of this letter. What's the purpose? You want to say, I'm trying to get a medication evaluation for my client. That would be stuff that you would want to cover in the introductory basic information section of your letter. In the second paragraph, you're going to want to introduce the presenting problem. How is this problem currently affecting your client? What are the symptoms that they're manifesting? How is this impacting your client's life? You want to talk about how your client is functioning at this moment in time. You also want to talk about the history of the problem. How long has it been going on, if you know? When did it first occur? Are there other triggers, other information like that that you might know about the presenting problem? Also in this section, you might want to discuss any kind of past psychiatric diagnoses, hospitalizations, any other medications your client might be on or is currently on. In this third section, you'll want to discuss your client's personal history. You'll want to talk about kind of their vital statistics, what their relationship status is, do they live with anyone, what their employment status is, kind of what their general life situation looks like. You'll want to talk about any kind of history of substance abuse they might have had, any kind of history of trauma they might have had. You want to discuss what their family of origin looks like, if that's applicable. You'll want to discuss what their current social life looks like. What's their social support system? What kind of supports do they have? You'll also want to discuss any kind of medical history that might be known at this time. If there's been any testing, you might want to note if there's been any history of head traumas or things like that that could point towards neurological issues. Um, so you want to give a general overview of who your client is for background purposes. So just make it very succinct and cover the things that seem pertinent to getting an evaluation for medications. In this section, you're going to want to give your subjective assessment of the client at the time of the session, how they presented. This means you're going to include the client's orientation, their mood, their affect, insight, thought content, their thought process, their speech, and their appearance. It's important to note all of that. It's also very, very important to note a suicide assessment. You should mention this in the body of the letter, whether the client presents as suicidal or not. You should make a note of it that the client did not present as suicidal, or that you questioned the client showed no signs of suicidal ideation. Something along those lines needs to be included in the letter as part of your clinical assessment of your client. The next section should include your differential diagnosis, and this means that even if you're not sure what the diagnosis is for your client, you want to give your best attempts. You want to give stuff that you maybe want to rule out. You're going to want to use DSM-5 codes for that in communicating with the psychiatrist. And obviously the psychiatrist is going to do their own diagnostic assessment, but it's usually really helpful for them to know what your thoughts are since you've been working with that client for a considerable amount of time. And finally, in this last section, you want to close your letter by requesting follow-up information. You might want to know if there were test results, what those results were, what medications have been prescribed, so that you can help monitor side effects with your client and help them communicate more effectively with their psychiatrist. You also want to thank the psychiatrist for their time and for their work in collaborating with you. And yeah, don't forget to sign your letter. Thanks.